So just this is quickly what we're going to talk about. We're going to do a quick introduction about what is GP training. We're going to speak about a few things that might help you during your training. And we've also added some stuff about maternity leave and when exactly can you apply for GP training in the UK. Okay, so basically GP training is also known as family medicine. In the UK, unlike other countries, in order to get in touch with any like specialist, you need to get either through your GP or through A&E. So the GP is mainly the first point of contact for patients with the NHS, and then the GP then decides if they can treat them on their own or if they're going to refer them to a specialist. So every single thing that you can think about comes through the GP, like pediatrics, gynae, surgery, internal medicine. You deal with diabetes, hypertension, even social stuff. You deal with all that. In order to apply for the GP training, you have to, of course, have full GMC registration. You have to pass your MSRA exam. Now, the cutoff for this year was around 506, 503 kind of thing. This was the lowest score for an offer this year. Each year it changes. So you need to keep an eye on the cutoff in order to know what you need to get in the next round. So anyone who's entering the MSRA exam in the next round, it will be very likely that you'll need a higher score than the 503, 506. So each year there's 5,000 plus spots available all over the UK, and you get distributed according to your preference and, of course, according to your MSRA score. Now, the GP training is a 3 year training. There is discussion about making it 4 years, but it's still not applied yet. So anyone who's entering this year, next year, are still within the 3 years kind of situation. So you have ST1 to ST3, and this is divided into hospital rotations and then GP placement. Now, every single trust does it differently. Every single deanery is different. So some people would have their hospital rotations first for a whole year, and then they have their GP placements. But other deaneries do it in a mix. So you do have some GP placements within hospital placements as well. So the hospital placements are kind of unified all over the UK. So pediatrics, A&E, psychiatry, medicine, all these are very common to have, but there's the one-off, like in Blackpool, for example, they have an ortho rotation in A&E. So it's different from every deanery again, but the standards are peds, A&E, and medicine. Now, in order to pass through your GP training, you need to have your e-portfolio, which is called the 14 Fish. You need to do your work-based assessments, and you need to pass two exams, which are the AKT and the SAE, and we'll speak about them later in this seminar. So the recruitment process here in the UK are 2 rounds, and the 2 rounds have two different entries. So round one, you start in August, and like most of you said, you're going to be doing that. Round two, you start in February. So round one, the application process opens around the end of October and they close at the end of November. And then you need to be invited to your MSRA exam. Once you get the invitation, there's two windows of examination in Jan and then again in Feb. And then we get the results in March, and this is when all like the offers come on. Now, round two, which is going to happen soon, the application is going to open in end of July. It's going to close in August, and then you're going to be expected to be invited to the exam at the end of August. And basically, the MSRA window is around the 4th to the 11th of September. Now, the results are expected to be in October, but the date is not set yet. And the first round of offers is going to come at the end of October. Now, what do you need to know before you start your training? So basically, you need to all be registered with the GMC and RCGP. The RCGP registration is going to give you the application 14 Fish, and this is your portfolio that you're going to use for the next 3 years. Now, it's very important to know about indemnity cover, and we'll discuss it in the next slide. It's also important to know what the RCGP provide. Now, there's something called RCGP mentoring, in which you pick one of the GP trainees or one of the GP partners or salaried GP in order to be your mentor throughout your training. It's different from the educational and clinical supervisor in a sense that you kind of feel it's a friendly environment. You just send them messages and they reply back. You can have a few meetings. You can also do GP, like RCGP mentoring after you qualify. So you still get this when you're like a salaried or a partner. Now you need to arrange your supervisor meetings before you start your training or in the first week or two of your training. And there's some very useful websites that we're going to talk about, and I'll take you through them towards the end of this lecture that are going to be very helpful throughout your GP training. Okay, so indemnity cover. So indemnity cover is an important topic because this is what basically helps you throughout your training or even after your training, and it keeps you covered, as it says. So as a trainee in the UK, you do have a basic NHS cover, and that covers you throughout your working hours that are in your training and in your contract. But if anything happens outside of your working hours, you're not covered. So if you have any mistake, any ethical problem, any issues that happens outside of your normal rotations, you don't have any cover from your training. And therefore it's important if you're gonna have any locum work, and locum is basically what we call extra shifts in the UK, you need to have an extra cover. And as you can see here, there's a few like societies that you can register with, like the MBS, the MDU, the MDDUS. I wouldn't say there's a much difference between them. They're just different cost. So you pick whatever is suitable for you. So if you want to do any extra shifts, I would recommend to get an indemnity cover before starting any rotation in the UK. Now, basically, rotations and meetings. So the rotations in the UK are 4 to 6 months. These are the hospital ones. And then you have the GP rotations as well. So the 4 to 6 month is different from every trust. For example, when I did my own training, I had 4 months. So I had three like hospital rotations, but other trusts or deaneries, they do them in a 6 month duration. So you only have like two rotations. Now you're the one who pick and you're the one who say like which one is the priority, but it doesn't mean that you're gonna actually get it, but you just prioritize your preferences. So if you have enough experience in medicine and you know nothing about peds or gynae, which are like very important in GP, then you might want to put them first. And then it's a first come, first serve kind of thing. So these are the rotations that we're looking out for. And we'll do other seminars to tell you exactly what you would expect in these rotations and what to do in what cases you might get. So that's going to be for another seminar. Now, there's something called the GP Plus rotations, and these are done within your GP placement, and they kind of help you with your special interest, and they also help you when you become a qualified GP. So these are the things that you've not really done in your hospital rotation. And they're like basically clinics that you go to, and they're ENT, dermatology, sexual health. Now you choose them, I would say choose them according to your preference, because it doesn't really matter what you choose according for your GP placement, but it matters later on if you want to do a GP with special interest. Now, before you get into your like rotations or at the very first week or two in your rotations, you need to do a few meetings. So you'll have an educational supervisor and a clinical supervisor. Educational supervisor is the one that's with you all throughout the 3 years of your training, but the clinical supervisor changes every single rotation. Now, both of them, you have to have an initial meeting with them. And in this meeting, you basically discuss what you're looking into, what exactly is your learning like curve, what exactly do you want to get out of the rotations, and what you're expecting from them. And then they have another meeting towards the end of the rotation to see your progress and to give you some feedback. And this happens twice a year. And then there's one near to your ARCP, which is basically the panel that signs you off to say, yeah, you've passed your ST1 year, the ST2, so on. So make sure to get in touch with your supervisors in advance and to set up these meetings. Now, there's something quite important. We didn't really discuss it in the last seminar, but it's something called shadowing. Now, not every single trust provides it, but it's important to know about it, especially for people that are coming into the NHS with no NHS experience. you're entitled to something called shadowing. So shadowing is that you're not actually working, you're just observing other doctors. So, for example, let's say you've started your pediatric rotation, you've not had any NHS experience, and you don't really know much about pediatrics. So, you ask your supervisor to give you a week or two of shadowing. It really depends on like the level that you want it to. Usually, in the hospital, they provide a week or two. Some hospitals, they provide a whole month, but it is quite rare. So just ask before going in, can I have shadowing? And it's important because there's different systems that we use here in the NHS. Most of the trusts are computer based, and it will take you some time to get used to what exactly to do, how to refer patients, how the word round works. So it's a good idea for you to shadow another doctor, and they would teach you what exactly to do. It's also available in your GP placements, but in the GP setting, they're a bit, I've noticed that they're not very cooperative in giving you so much time. So again, I don't want to like, generalize. It depends on what kind of GP practice you're in. So just ask before you go, can I have a shadowing period? And the shadowing period that the RCGP recommends or gives a limit to is 2 weeks. So if you can ask them, can I have a shadowing or shadow one of the doctors? Sorry, I went back by mistake. So if I can shadow one of the doctors, and they'll be happy to provide it if it's available. Okay. If I'm going too fast, just let me know. And if any questions, just pop them in the chat box. Just make sure to ask about your shadowing. I think it will help a lot of you. Now, for the leaves, there's three kinds of leaves that you're entitled to, and they're in your contract. So the leaves that we have are sick leave, study leave, annual leave. Now, for your sick leave, you're entitled to 30 days throughout the whole year, and they're paid, they're completely paid. But it also depends if you're a less than full-time or a full-time trainee, because these leaves they decrease if you're less than full-time. Now, once you finish your 30 days paid leave, you can get another 30 days, but they're half paid, and then you get another 30 days that are unpaid. If you exceed these leaves, then you get something called an unauthorized leave. And anyone on like a visa, it's not really recommended because it's going to affect your ILR in the future. So be careful with with the sick leaves that you take. It's also important to know that each trust is different. So check your contract. Make sure that the days are in your contract. If they're not, then ask them to be before you sign them or before you start your work, because it's very important to have your sick leaves there. The other thing to know is that a lot of trusts do something called episodes. So, for example, let's say I'm going to be sick today, and I'm sick for 2 days, but I'm also generally off. Like my days off are another 2 days. So now you're off for a whole week. So some trusts, they actually calculate this as a whole week. And then if you're off again for another day, they take it as another episode. So let's say I have a cold, I went into work, I couldn't work, so I asked for a day off. And then I went back into work the other day, and then I took another day off on the third day. So these are really two episodes. It's the same illness, you're still having the cold, but they calculate it as two episodes, and sometimes they're flagged up. So if you have a lot of episodes, there is a meeting that they sometimes do, and they need you to sign some forms. So I would say if you're actually sick, just take enough days off. Do not come back to work when you're unwell and then take another day off in the same week. That's my general advice to anyone. Now, the study leave is again another 30 days, but it's including the teaching. So when you take the teaching out, you have 11 to 10 days left in total. Use them wisely because they're paid and you're entitled to them. So don't leave your study leaves until the end. And they're very important to help you with like your progress, with your exams, with your special interest. So try to use your study leaves as much as you can. Again, when you're less than full time, your study leaves reduce. So make sure to have them in your contract or make sure to know about them. For your annual leaves, they're 25 to 27 days a year. And of course, they're less when you're less than full time. Let's say, for example, you're 80%. So you get only 21 days a year. Now, it's important to know about maternity leave, especially for people who are coming in newly to the UK. Most people are entitled to have maternity leave about 12 months, when they've worked for 12 months in the NHS, or at least 26 weeks before your intended break or before your birth. So again, make sure this is in your contract and make sure to read your contracts very well to know what you're entitled to. Now, the way the maternity leave works, it can be around like a whole year, but you're not paid the whole year. You're paid only for 8 weeks fully, and then you get paid half paid in the next 18 weeks with something called the maternity like allowance, which can be ranging from 80 to £100 a week. And then in the upcoming 13 weeks, you only get paid the allowance. So you're only getting around £100 a week. And then the last 13 weeks, you're not paid at all. For anyone with a partner, your maternity leave can be divided between you and your partner if you wish. And you just need to know that you need to apply for it well in advance. So you can apply for it 11 weeks before your childbirth, or you can apply for it after your childbirth. It really depends when you want it, but you need to submit it 15 weeks in advance. Now, this is the special interest slide, and the special interest is quite actually interesting because you can be a GP and you can be a specialist in other areas as well. You can have clinical and non-clinical areas. Now, the very common clinical areas that GPs tend to take a special interest in is dermatology, women's health, mental health, pediatrics, sometimes cardiology. Minor surgery is not really like a big special interest situation because you only get a course for a day or two and then you can start doing it in your practice. If you're interested in minor surgery, then ask your educational supervisor or your GP practice if they can support you with this and if you can see cases or observe cases, because then it really improves your hand skill. And in the future, then you'll be able to do it independently. Now, the non-clinical areas that you can do as a GP are medical education, digital health, and leadership. So you need to ask if your GP supports it, because in some GP setting, they can provide you a fellowship for these special interests, but it's not very common, but you need to ask about them. Now, some special interests are done by certain courses or diplomas. So if you go onto the college, for example, when I was doing my pediatrics, I had to go onto the Royal College website for pediatrics and do the diploma for pediatrics. It's two exams, you need some working hours and that's it. But other like special interests, they need you to do certain years. So if you're doing dermatology, for example, you need a 3-year course diploma. And again, you need to ask your like your supervisor or your GP that's going to provide you with your salaried job if they can actually support you with your fellowships or with your special interests. And it would be really good if they can do, because then it takes a huge sum of money off you, and you can focus on your exams and studying for it. Now, for the exams that you need throughout your training, we have two of them. So we have the AQT, which is an MCQ based assessment. It's around 200 questions, roughly 3 hours. It's done in a computer in a center called Pearson Center. 80% of it is clinical, 10% is admin, and 10% is statistics. The pass mark each year is roughly around 72 to 75, but it goes up and down depending on like the people that are going into the exam with you and how is this course. It's really a curve. It's not a standard. So in some years it was 69, in other years it was 78. So it's different every year. You're expected to take it around your ST2 time, but you can also take it in your ST3. You only have 4 attempts. So if you fail the 4 whole attempts, unfortunately, you cannot sit the exam again. And it would be a bit of a difficult situation because you cannot really progress in your training. But in some situations with some people, your supervisor can actually request an exemption and you can sit for the fifth and final time. In order to prepare for this exam, there are some free websites and some free courses that you can take with the RCGP. They have on the RCGP, when you register, you're going to find something called GP self-test. The GP self-test is a free MCQ question bank that you can use. Of course, the exam is based on our NICE and CKS guidelines, but I would say it's not reasonable for you to study from them. And anyone who's checked the NICER sign, it's very detailed. So I wouldn't say it's the best approach, but it's a good thing to like, follow up with them and make sure you're getting the right information. Now, the best way to approach your AKT exam is by doing MCQ banks. And there's a few of them, the PASS test, the PASS medicine, the BMJ. For me, when I sat for my exam, I've actually done three question banks. So PASS medicine, BMJ, and I've done a bit of the e-Medica as well. But everyone is different. I would say BMJ is the closest to the AKT exam. Now, the SCA one is what we call the OSCE, and it's basically role players. They pretend to be patients, and you're the doctor. It's a 12 simulated consultations. Each consultation is 12 minutes. You get 3 minutes in between each station in order to read the scenario. Sometimes the scenarios are quite straightforward, and sometimes they're quite long. And then you're tested on like your rapport with the patient, your communication skills, your clinical management, and your safety netting. The pass rate for this exam is about 65 to 70%, so it's a bit less than the MCQ one, which is expected with OSCE exams, but it has the same set of like attempts. So it's 4 attempts, but you can get exempt for the fifth time if you need it. Now I'm gonna take you through the helpful websites. So there's the free access websites like the GP Notebook, the RCGP, the Bradford, of course the CKS, which we all use until now. And then there are paid websites like the Red Whale and MB Medical. And these are the ones that you get mainly your training from, and you use your study leave with these websites. But before I show you like my other page for these websites, anyone has any questions at all? We spoke about the study leave. So to use your study leave. Your study leave is a day, it's not really a day off, but it's a day of study. You can take it online, you can take it face to face. It depends what you want to do with it. And it helps you with your portfolio. It also helps you with your special interest. So these are the websites that you get your study, like your training from, or like the lectures or whatever you get them from. So Red Whale is a very famous one. You can get the GP update courses. You can get, like, for example, managing blood results, lifestyle, urgent, the urgent care ones, women health, mental health. It's important to know that these are all paid, not from your personal pocket, but from the deanery's pocket. So the way it works is that when you apply for a course, you pay it yourself at first, and then you apply for the money for you to get it back. If the course is not online and you're going somewhere, the deanery should cover you for your transport. They should cover you for your staying over. So any accommodation, any, for example, fuel that you've used, this is all covered by the deanery. Now, the exact amount of money that the GPs are entitled to is a bit of a dilemma because no one can really tell you exactly how much, but it ranges around 4,000 to 6,000 pounds. This is your study budget. Some people are saying it's more, it's like 8,000. So use them wisely, I would say. So take as much study courses as you possibly can, whether face to face or like online. So you can get them from the Red Whale. You can also get them from your RCGP. So if you go into your RCGP and when you go around here in your learning and you press on courses and events, you can find all the courses and events that the RCGP provides. So you can see them here, and when you go in on them, some of them are free, some of them are paid. Now, the minor surgery course, for example, if someone was asking about the surgery, minor course is a good idea to take because you can do it in the practice. So the minor surgery course is the one where you like remove cysts, you remove like lipomas, things like that. So this is the minor surgery course. It's a paid course, but then you get the money back. Now, it's important to know that there are courses for your exams that are provided by the RCGP. So if you go through the like your learning and courses, and then you find there's RMRCGP, SCA, AKT courses, they're really good and they are quite helpful for your exam, but they're always sold out, as you can see, especially the 3-day courses. So just plan in advance. and apply to them throughout like your study budget. And then again, you get them paid back. The statistics for AKT is important because we don't really get any statistic teaching much apart from like one lecture, and I think it's not enough for the exam. So make sure to take as much courses as you possibly can. Okay, so these are the websites for you, like your study leave. There's a few other, like the MP Medical. As you go throughout your training, you'll find people talking about different websites and where to get your courses from. But then there's like free websites. They're not really courses, but they help you with the cases that you see. So if you're starting a GP rotation, the GP Notebook is a really good website. It's the one that we have all the guidelines on, but it's kind of like simplified rather than the NICE or the CKS. So for example, let's say I want to look into angina. So I just type it in. I go into the angina. It gives you like a description, but what we normally use as GPs are these algorithms to know exactly what to do, who to refer to. And then if you go down into like the management part and the referral criteria for primary care, these are the ones that you need to like know by heart eventually. So if you go to the referral criteria, it tells you exactly who to refer. Because sometimes you can refer patients and then they get rejected, or you've done like an inappropriate referral. So you need to check these websites before doing anything. So for anyone coming newly to the UK, it's a really good website. Also the CKS, of course, we all know, not all of us, but most people that are in the UK know what the CKS is. And it's the one that has all the guidelines in it. But I find that it talks a lot. Like it's a bit detailed, but again, it's you can see the management, you can see like the referral, the medications. The BNF is something that we all use every single day, and it tells you exactly what kind of dose you put you like the medications that you put them on. So, for example, let's say you're starting a patient on Ramipril, you just type it in, and then you go into the medication and you find exactly what the dose that you need to start in, and for how many weeks, and the monitoring bloods for it. So it's important to know these websites before starting your training because it will help you with the patients. Now, there's a free one called the Bradford VTS, and it's really good because it has every single thing in it. It has your AKT sources, it has your SCA. It also has some for PLAB 2, so anyone who's sitting the PLAB 2, that one is for you. And it gives you some ideas about what to write in your portfolio. So if you go through it like your educational supervisor RCP, for example, it tells you what's expected, what to write in your portfolio. So I would say it's a good website. That's it for today, really. If there's any more questions, I'm happy to answer them. But if everyone is happy, if you want to like send your email, I'll also send the link for our WhatsApp group. So I'll send it through now. And if you want to join our WhatsApp group, we'll then share when is our next seminar. And our next seminar might be about the portfolio and exactly what entries to put in your portfolio. So if you're interested and you want to join us on that one, just register with us.